Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diffusion capacity. For finding the diffusion capacity, we have a test called as we can do single breath diffusion lung capacity of carbon monoxide study for diffusion capacity. So this diffusion capacity of lung for carbon monoxide is reduced in all patients with intrinsic lung disorders, whereas in those patients with uh, dis- diffuse diffusion capacity of lung of for carbon monoxide, this is actually normal in patients where the problem is in the chest wall. So in it is actually normal in extraparenchymal restrictive lung diseases. In extraparenchymal restrictive lung diseases, the defect is in chest wall and the muscles, neuromuscular lung disease. So as a result, the diffusion lung capacity for carbon monoxide is normal. Diffusion lung capacity for carbon monoxide is most sensitive parameter, and findings may be abnormal. These findings may be abnormal even when the lung volumes are preserved. That is, you can see abnormality in the diffusion lung capacity is even seen in mild intrinsic lung disease also. We can see the change or abnormality in this diffusion capacity of carbon monoxide. So thus it is a sensitive indicator, whereas in any type of obstructive lung diseases it is normal. Only in restrictive lung diseases it is reduced, whereas in extraparenchymal restrictive lung diseases it is not reduced.
thank you and thank you for watching.